And as the presentation takes place, if you have any questions, please look to your far left, my right. There is a chat box that is located at the bottom of the page. Type in any questions that you may have, and we will do our best to address them. If we don't have an opportunity to address them on this mini webinar, we will get answers and post them on our website or send them directly to you. Before we get started, if you look at the top of your menu bar, there are several icons as well as terminology. On the very far right, you will see a silicon of a person with the hand raised. If you have a question, well, not question, because this is a mini webinar, excuse me. But if you are asked a question and you want to participate, we encourage you to participate. You just click on that icon and it will raise your hand. And you can just click on it again and then it will go off for you. Today we have with us Beth Barry, who most of you know, who is the Senior Program Manager for the Alliance for a Healthier Generation. She will be presenting the webinar for us. And we have a featured speaker, Kathy Kilgore, who is Director of Dining Services at Anderson School District 4. Kathy is with us because Kathy has done some wonderful things in her district, and we sent out a request for best practices. So if you have a best practice in any area of the wellness policy, please feel free to share that with us, and you can share it with us at wellnesspolicy@ed.sc.gov, and you will see that website at the end of the presentation. So before we get started with Beth, please make certain that everyone can hear me. If you can hear me, let's test using the icon above. If you can hear me, would you please raise your hand? Okay, everyone is using the icon. Wonderful. Thank you all so much for your participation. And with that done, what we will do is you will hear a brief moment of silence as I pass the microphone off to our guest speaker, Beth Barry.
Good morning. I'm happy to be with you. And we are going to be talking about actively engaging your CSHAC in your local wellness policy process. And we're going to have an opportunity for you to share. And then we will be hearing from Kathy Kilgore, as Juanita mentioned. Okay, for a quick review, these are 5 items that must be addressed in your local wellness policy. And the one that you see circled in red, of course, we're talking about today, is your CSHAC. Also, you going from left to right, you have to have specific goals for nutrition promotion and education, for physical activity and other school-based health promotion activities. Food and beverage marketing policy needs to be in your wellness policy. You must address standards for food sold and served, and have a description of your public involvement and updates, policy leadership, and evaluation. And our state technical assistance team for local wellness policies is in the process of finalizing a checklist to help you make sure that your wellness policy has the 10 required components. So we will be sharing that in the very near future. Okay, so why do we have a shack or a CSHAC? Of course, one main reason is because the U.S. Department of Agriculture tells us we should do that. With the Healthy Hunger-Free Kids Act, we're required to permit participation by the general public and the school community and there to help in the development, implementation, the periodic review and update of the wellness policy. In South Carolina, we also have the Students' Health and Fitness Act, which some of you were around in 2005 when that was passed. And that's why in South Carolina we refer to it as a CSHAC rather than a SHAC, because in our state law it states that each district shall establish and maintain a CSHAC to assess, plan, implement, and monitor district and school health policies and programs, including development of the district wellness policy. And one thing that I think is really important that I run into school administrators and district administrators frequently who do not realize that law also requires that each district with their CSHAC shall develop a school health improvement plan to be included in the district strategic plan. And that school health improvement plan is supposed to address those things we just mentioned. So it's really important that we know that we're meeting not only federal but also state requirements when we have our CSHACs. So who serves on the CSHAC? The local wellness policy final rule actually tells us that the general public has to serve, and they give examples of that as being your local dietitians, any representatives from businesses, and healthcare professionals, community, civic leaders that are interested in children, nutrition, education, health, and physical activity. And although the rule does give examples of who needs to be involved, and they talk about required stakeholders, they also do give the caveat that the districts have the discretion in exactly how they implement this requirement. So that is always good to know as well, that we have that discretion. Okay, they also say members of the school community should serve on the CSHAC. And the examples they give of the school community are parents, students, representatives of the school food authority, your PE teachers, school health professionals that could be health ed teachers, school health services staff, social services staff, school board, and school administrators. So what I would like us to think about right now, and as Juanita had you practice with raising your hand, this is just for participation. It's not evaluation. But if your district CSHAC does include these members that are recommended by the Healthy Hunger Free Kids Act, would you click on that icon and raise your hand? Okay, we see some hands raised. That's great. Glad to see it. Have your members received an orientation as to their roles and responsibilities on the CSHAC? If you could raise your hand if you feel like they've gotten an orientation. And is anybody willing to share how the orientation was handled, how you recruited members for your various roles? You can either type it into, okay, and we have a question, what if you don't have all of those members? That's fine. These are suggested members, and remember, it is good to try to have someone from each of these categories, but if you don't, you can think about recruiting them. And then also, the final rule does say that the district has the discretion in actually how you implement that requirement. So that's kind of your safety. And if you could show how you document how you try to get them on the committee. Yeah, did you have email? Did you meet with them personally? Did you call them? Anybody want to share? You could, oh yay, we've got someone typing. Okay, and we'll come back. We appreciate you typing that in, and when that's finished, we'll. Okay. It is good to reach out with email. District Bullying Suicide Committee, and we use the people on that committee. That's great. There's no need to reinvent the wheel. If you already have a committee that's willing to also address wellness, that works. So that's great. Good, good, good. Okay, the role of the CSHAC. At a minimum, the final rule says that they should be involved in the development of the local wellness policy, implementing the local wellness policy, and the periodic review and update of the local wellness policy. You can certainly do more than that, but that's at a minimum. And remember that the wellness policy final rule also says that leadership should be someone that has the authority and responsibility to ensure that each school complies with the policy. And I know we've heard loud and clearly from many of you that you don't have that authority. So that might be something you could share with your district leadership if you've been voluntold or you eagerly volunteered to be the designated person for the wellness policy for your district. You could say, you know, the USDA says then I need to have the authority to ensure that all schools comply with this. Reviewing, we are going to be talking in the near future about this is a great time to review your wellness policy. I mentioned the checklist we're going to have to help you with that. And so that is a really good activity for your CSHAC. Also, this wellness policy final rule requires that you've got to state how or be prepared to share how the policy and assessments are made available to the public. That's not specifically the role of the CSHAC, but it would be a great thing to get their input into how you think that how they feel that should be shared. Again, in helping with the assessment of your policy, and then, as you know, every 3 years at a minimum, the assessment of your policy needs to determine how well it is, the schools are complying with the policy, how the policy compares to a model policy, and your progress in attaining the local wellness policy goals. And remember, we have the district wellness policy annual progress report that is due each year. So that is another thing that you can have your CSHAC assist with. Look at what you turned in last year, see what you are fully implementing, what's partially in place, and get their help with how you want to move forward on that. It will be due March 15th this year. So think about if your school board and school administrators recognize and support your CSHAC's role in improving and promoting school health. Do they seek their advice? Do they act on their recommendations? And also, do you provide any recognition for your CSHAC and the members to let them know they are appreciated and you are glad that they are serving? These are characteristics of an effective CSHAC. We've talked about they need to have diverse representation. You need to reflect the community as well as some of those stakeholders that were mentioned. You need their buy-in and involvement. They're there to advise and advocate. This isn't all on you. They are there to help. They are there to help you identify priorities, support the priorities, and to help you take action. So think about the members on your team. Think about what you feel is working well. And we are now going to move on to our wonderful Kathy Kilgore after I highlight effective meetings and tips for having effective meetings. Remember, if you can have a regular meeting schedule, the USDA does not require a certain number of meetings, so you can decide what's appropriate for your district. Be sure to have an agenda. Remember email, phone communications to keep them informed. Make sure they have the resources they need to be effective members. Punctuality at your meeting, start on time, end on time. Make sure it's a supportive atmosphere where everybody feels their voices will be heard, and that you follow up after your meetings so that they have a summary of what happened and know what your next steps are going to be. Okay. Anybody have any questions?
Okay, everyone, let's raise our hands and give Beth a thank you for doing such a wonderful job. No, let's click on our mic. Let's give her, we raise our hand, but let's give her an applause. Let's see who can figure out how to give an applause while we wait to pass the mic off. Let me show you just a new feature. You see the arrow that points down next to the individual on the right? Click on that and give me an applause. Give Beth an applause. No applauses for Beth? Okay, if you were to click here, then you can give, there you go, everyone's got it. Thank you. And so what we're getting ready to do now is to pass the microphone over to Kathy. Before we do that, one question did come up. Will the slides be available to everyone? We will work to get the slides to you. It may take a couple of days, maybe mid next week. And we will also try to post it on our web page, which is www.ed.sc.gov, and you just go down to the Office of Health and Nutrition and click on Everything Wellness. And it will take you to a previous webinar that was done to show you how to access the annual wellness policy tool that Beth referenced. And just to follow up on what Beth said again, as it relates to having all the members on your committee, you must document that you attempted. If you can't get them, we know you can't make people participate, but you must document, especially for your AR, that you made an attempt. And how do we know you made an attempt? Via email, via any type of correspondence that you sent inviting individuals to participate. So now what we're going to do, you may hear a moment of silence as we give Kathy Kilgore access to the Kathy, are we going to test you? Would you say something, Kathy? Kathy? Okay, Kathy, we're going to try that one more time. And while we're waiting to get to Kathy, where's Kathy?
How about now?
Okay, can you hear us, Kathy? Kathy, can you speak?
Can you hear me now?
We can hear you, Kathy. Can everyone else hear Kathy? Okay, Kathy.
Okay, I'm sorry about that delay. Okay. I'm not sure how loud that is, but we will try. All right, I will go ahead and continue and y'all can let me know if you can't hear me. I'll just go ahead and start about what we're doing in Anderson 4. I think really what's probably most exciting for us is, and what makes us most successful is our diversity and really making the Jumpstart Wellness Council about something that is that you're chosen to and something that's exciting to do rather than something that you have to do. So it starts back in the summer before the school year starts, and principals are asked to send in names of potential participants, and those include uh, teachers and students of their schools, as well as a parent as potential candidates. And then once those are received, then we send those participants letters, and the letters say, congratulations, you've been selected to participate. And I think that sets the tone right from the beginning that it's an honor and something to participate in rather than oh shucks, another committee that I've have to serve on, rather something celebratory. So that gets things going right from the beginning, and then we have a wide variety of nurses, PE teachers, special ed administrators, and so forth from the different levels of schools that we have. Then we set the tone by rotating where we hold our meetings. We rotate our meetings at various schools in the district, and the right from the beginning we have school lunch, and I think that kind of sets the tone to feature healthy options to encourage students as well as staff and our administrators from all over to eat school lunch and eat a healthy lunch and to see what's offered in different schools. So it's something that as a food service director, we have a lot of pride in, and something that we're very proud of. So it gives us a chance to show what we have. The meetings themselves, something that we've really focused on is celebrating our successes and recapping our wins. Something that we've learned along the way that I think has really taken hold is to make sure that they get the participants moving and active rather than just a sit and get type of a meeting. We've made sure that since students are involved from elementary age up to high school, that it needs to be hands-on. And I think when you start talking about wellness policies as well as some of the things that you want to accomplish, it's not necessarily exciting for a fourth grader, or so it's important to get them involved. And I think healthy eating and nutrition, including cooking activities, which is really one of the things that we are now including in every meeting, is some kind of nutritional activity, whether it be a taste test, a new recipe that we're doing in student nutrition, or just a recipe in general tied with nutrition education. I think it goes really well with what we're trying to accomplish with local wellness policies. And it shares and educates these folks as well, and it gets them a little excited and something to look forward to, as well as holds their attention. So this has become a really successful piece of our meetings, gives them something to look forward to, something to give others to want to participate in, something to get them to want to look forward to. And then we've also included little chef hats and t-shirts and things like that to give others to look towards of, hey, maybe I want to get involved with Jumpstart and the Wellness Committee and spread that kind of culture. So, and as far as the student nutrition department, as you know, this is a big part of what we do, and I think it's real important for us to be able to share some of our successes and some of our challenges that we have, as well as some of our messaging. There's a reason why we're doing what we're doing, and some of our accomplishments as well. So if we're serving legumes once a week, there's a reason for it. And oh, by the way, here's some of the nutritional benefits of eating legumes, for example. Some of the other things that we do that I think that are real successful is that we get input from the group, and some of the pictures that are included are the color run. This is, I think 2016 was probably our first color run. We have district events. We talk about them in our wellness meetings as a priority. What are some things that we want to do as the different school members come, and then district support events. So color runs, turkey trot. There's some different examples of events that we support. And there's a picture of one of our cooking activities that we did. And those are our serious Chef Ramsay poses. So I love that shot, but that's what that is. But they look forward to that. We also, like I said, get them really involved and it gets them excited. One of the things that I think is important is to celebrate wins and solicit feedback from this group. It's important for them to feel heard and participate in activities. Let them get up and moving, and let them share in what's going to be important, and share in the vision. And when they decide what some of the priorities are, we literally vote about what we're going to make one of our priorities for the district. So, for example, some of the messaging this year, what are some things that are going on in their schools that we as a district want to focus on? So vaping, for example, came up. So that's something that we're going to work on as a district to talk about and message through social media, for example, this year. So, for example, that is a topic that will go out in our district and aligns with other wellness topics that we've talked about. Towards the end, when you talk about supporting their priorities, I think that's important for those schools. Kids get a voice, students get a voice, teachers get a voice, parents get a voice. Everyone, as we go around the table, they equally are able to share their ideas. I think that's important as well. And then the take action part is recapping at the meetings, sending out our minutes at the end, and we email those out, as well as perhaps mail them out about what we did and what action steps we took. So we start the beginning of the meeting with, here are some successes that we've had. Here are some things that we've done to remind everyone, because as you know, that we're all in different school buildings and we may not know of some of the great things that are happening. And then we send them out at the end. One other great thing that I just want to mention is that in each location that we go to, there are student ambassadors that are represented, that we've labeled them student ambassadors, if you will, and given them that title. And they start the meeting out by telling us about the great things going on related to health and wellness in their school. So it gives them a chance to share and celebrate some of their own success, and we recognize them for that. So I hope that's a quick run through, if you will, about some of our successes and some of the things that we do. But I think it's important to share and make it a privilege, if you will, and support these people as they support us in our mission.
And before we conclude the webinar, let's give Kathy a hand. Applause. Let's give Kathy an applause. Okay. Remember how we give an applause, right? We just click on the icon and give Kathy an applause. Wonderful, Kathy. Thank you for sharing that information with us. Kathy is the Food Service Director of Dining Services in Anderson 4, and she is our district expert on getting your wellness committee up and moving. And so if you would like to contact Kathy, again, she's in Anderson 4, and Beth is everywhere. And so we will make the webinar available to you all. And if there aren't any more questions, thank you so very much for participating in the webinar. And please remember, if you have any additional questions after the webinar, you can ask your question and place it in wellness policy at ed.sc.gov. And we're going to put that on the, it appears on the screen now, wellness policy at ed.sc.gov. Okay,
And we're going to try to give you a clickable link, so just bear with us. Okay, and so if you were to just click on this link, it will take you directly to the website to to place your questions, and we will, within 7 to 10 business days, we will get a response back to you. Again, if there aren't any more questions, thank you all for taking time out of your busy morning. Have a great day, and please look forward to additional webinars to address the various components of the wellness policy that Beth mentioned on her first slide. Also, as we address these items, it is based on a survey that you responded to, saying that this was your needs, and so we're trying to meet your needs. If any additional topics that you're interested in that relates to wellness, please feel free to reach out to us at the wellness policy at ed.sc.gov. Now, we featured Anderson for today. I'm sure that there are wonderful things that are happening in your district. Please share them with us at wellnesspolicy@ed.sc.gov and be our featured speaker on the next presentation. Thank you very much, and please look forward to the next webinar. Have a great day.